Welcome, everyone, and thank you for joining us for this panel discussion on employer-sponsored health insurance. I'm Marilyn Serafini, and I'm Director of the Health Project here at the Bipartisan Policy Center. Half of all Americans who have insurance get it through their employers, and most report satisfaction with this coverage. From the Affordable Care Act to the COVID-19 pandemic, employers have had to adapt to the shifting economic and policy conditions impacting the healthcare landscape as they seek to take care of their employees. Premiums and deductibles have grown over the last decade, and we anticipate that increasing inflation rates and cost increases are going to continue to impact employers and employees. Today, we are joined by 4 expert panelists who are going to share their perspectives on the current state of employer-sponsored insurance and what's top of mind for both employers and employees. First, we have Katie Mahoney. She is Vice President for Health Policy at the U.S. Chamber of Commerce. Tom Liebfried is Legislative Representative for the AFL-CIO, which is the largest federation of unions. John Ahrensmeyer is joining us. He's the founder and CEO of Small Business Majority, which is a nationally recognized organization advocating for America's entrepreneurs. And last, Sabrina Corlett, a research professor, founder, and co-director of Georgetown's Center on Health Insurance Reforms. We'd also like to thank the Robert Wood Johnson Foundation for its generous support. That support enables BPC to work on important topics such as ESI. We're joined by Kathy Hempstead, Senior Policy Advisor with our WJF. I'll turn it over to Kathy now before we begin the panel discussion. Kathy?
Thanks, Marilyn. Good afternoon, everybody. I'm looking forward to a great panel discussion about one of my favorite topics, the future of employer-sponsored insurance. Like Marilyn said, this is our biggest single segment, and it's been with us for a long time. Just a little context I wanted to just throw out there before we start is the percent of Americans with ESI has been slowly declining for the last couple of decades, mostly due to demographic change and expanded eligibility in some public programs. I think it's interesting that during the pandemic, even though we had a really major economic dislocation and a lot of people were separated from their jobs, we didn't see a lot of disruption in ESI. And, to a large extent, that's because many of the people losing their jobs didn't have ESI and didn't have job-based coverage to begin with. And over the past couple of years, we've seen a sizable increase in enrollment in public coverage, Medicaid, and then also marketplace coverage. But according to, looking at sort of the financial data that plans are filing, which I think is our timeliest source of enrollment information, even if it's got, some flaws for sure, it still seems like most of that increase in enrollment in public coverage hasn't come at the expense of ESI, and ESI declines are, smaller than those increases in enrollment. So there's still this sense of, relatively speaking, tranquility in ESI enrollment. But I think that thinking about the future, which I think our panel is going to talk about, there are a few things that I hope they get to that could present some challenges for ESI going forward. I think one of them that I'm really interested in is the quote unquote great resignation. It's not clear what that means and how large that's going to be and what it looks like, but that might have some implications for enrollment in ESI depending on its size and duration. Another thing, Marilyn mentioned the cost issue, which is, a long-term, really important problem in ESI. I think a lot of people anticipate that premiums might increase quite a bit due to some cost factors on the hospital side in particular. We have had long-standing frustration from employers. I think we're going to hear from some employers today about the cost of health insurance. And, over time, and especially recently, we've seen some experimentation with some new things like direct contracting, using ICRA to maybe send people out of the group market into the individual market. So I think that that's an interesting challenge too. And, a lot of employers are very dissatisfied with how much of their paycheck goes to health insurance, an amount that's, very likely going to increase in the short run. So I think we're going to hear from some employee perspectives as well. So with that, I'm just going to stop talking, sit back, welcome our panel, and I'm really looking forward to a fantastic conversation. So thanks very much for being here today.
Great. Thank you, Kathy. So a little bit of housekeeping before we turn to our panel. please, please, please send us your questions. We will get them to the panelists. We'll get through as many as we possibly can during the time we have. And you can submit your questions using the live chat on YouTube or Facebook, or you can use Twitter, tweet us your questions using the hashtag BPC Live. So at this time, I'm going to turn it over to our panelists to give us just a little taste of what we're going to be discussing today and to really set the stage. We want to hear what's on your mind and what you think, what are the priorities from your standpoint. I'm going to turn it over first to Sabrina Corlett. Sabrina, if you could please help to set the stage for us about the state of employer-sponsored insurance and what important trends we should be paying attention to.
Absolutely. Thank you, Marilyn. And it's a pleasure to be with all of you. I think this is an incredibly timely topic. As both of you noted, the employer-based coverage system has really been the backbone of insurance coverage in the United States, really since World War II. And it is sort of an essential piece of our healthcare system, but it is under a considerable amount of pressure. So the BPC asked me to just do a little bit of table setting here today, which I'm happy to do. I think, as Kathy and Marilyn noted, ESI, or employer-sponsored insurance, covers a healthy majority of us under the age of 65, about 60% of us. But it is, like I said, it's a market under strain. Although the coverage rates have remained fairly steady, they're not growing either, and offer rates have slightly declined in the last decade across all sizes of employers, but that decline has been particularly pronounced among small employers. So in the year 2000, about 50% of small employers offered insurance to their workers. Today, that number is much closer to about 30%. So really big decline in offer rates, particularly in the small group market. At the same time, for those of us who are lucky enough to have an offer of employer-based insurance, the generosity of the coverage that workers are getting is eroding as well. Our premiums have jumped close to 50% in the last decade. And when you compare that to wage growth, which is at 32%, and inflation, which is at 23%, our premiums are climbing much, much faster than both of those trends. On top of our premiums, the amount we pay to access care, access services out of pocket has also increased dramatically. Deductibles, that's the amount that you have to pay out of pocket before your insurance company will kick in. Those have surged almost 70% in the last decade, and today average over $1,600 a year for just an individual. Why? Why is this happening? I think, to a large extent, the answer is pretty simple, and I'll put it into the words of the famous healthcare economist from Princeton, Uwe Reinhardt. It's the price is stupid. And that's the title of an article that he wrote way back in 2003, providing very clear documentation that the primary driver of healthcare cost growth in this country are the prices that we pay for healthcare goods and services. And that's a much greater factor than our aging population, obesity, waste, or overutilization. And his 2003 report has been consistently backed up year over year with data. And in fact, a Congressional Budget Office report was published just last week and found that in the commercial insurance market, and that's where employers are buying their health insurance, spending per person on healthcare grew by about double the rate that spending in Medicare grew between 2013 and 2018. And CBO, just like Dr. Reinhardt, found that this growth was driven by the prices that commercial insurers are paying for healthcare goods and services, not enrollee utilization. Greg, if you wouldn't mind just pulling up that slide. Yeah, so I think this is from the Congressional Budget Office report. It does a really great job illustrating what these higher prices for healthcare goods and services translate to in terms of wages, benefits, premiums, and overall economic growth. So I think this is just a really nice illustration of the cause and effect. But what can be done about this? At this point, in spite of all this data that's been coming out since for the last 20 years, and the fact, quite frankly, that healthcare costs are hobbling businesses and workers alike, there's just not a ton of political will to tackle provider prices. That said, there are some interesting ideas. On the way left, you have things like single payer, or other left sort of more liberal ideas like public option. Those would constrain healthcare cost growth by essentially having the government set prices just like they do in Medicare. On the right, you have ideas, and Kathy mentioned this, like ICHRAs. These are individual coverage HRAs that would sort of, I think the idea there is to sort of let employers get out of the group health plan game altogether and have workers sort of take these accounts and buy insurance on the individual market. There are also some really interesting bipartisan ideas, like greater price transparency, more antitrust enforcement, and anti-competitive policies. And I'm hoping we will talk about these ideas and many more during this discussion. So thank you for including me.
Great, thank you, Sabrina. Let's turn now to Katie Mahoney from the U.S. Chamber.
Hi there, nice to be with you all. For those of you that are not familiar with the Chamber, we are the world's largest business organization representing companies of all sizes and sectors and industry, from the very, very small to the very, very large. It's a pleasure to be here with you today. We also highly value the employer-sponsored system as an organization and view some statistics as particularly relevant as we're talking about this coverage offering. I'll just give a couple to tee it up and then look forward to the discussion. 80% of employees rank their benefit satisfaction as extremely or very high. 83% of employees say health insurance is extremely important in deciding whether to stay in or change jobs. And 80% of workers would keep a job with benefits rather than take one that differed with more pay and no benefits. So I think it's pretty clear from both Sabrina's remarks as well as I think what we'll discuss during today's panel that the employer-sponsored system is the backbone of the American healthcare system, with over 180 million Americans enjoying this coverage and continuing to value it. I appreciated the trend discussion that Sabrina started with. I think one issue in particular is sort of the current trend as we're grappling with a pandemic and continuing to try to come out of that. In addition to kind of the health concerns that includes, significant workforce shortages, which are also having a pretty significant impact on employer decisions with regard to benefits. So look forward to the discussion.
Great, thank you, Katie. So John Ahrensmeyer, small business majority, small employers traditionally have greater challenges than large employers in getting coverage and taking care of their employees the way they would like to. Let's talk a little bit about those challenges, what we're seeing today, and what some of the important trends are there.
Thanks, Marilyn, and thanks for putting this on here. So just really quickly about Small Business Majority, we're a national small business advocacy organization. We have over 85,000 small businesses in our network and partnerships with over 1,500 organizations that serve small businesses around the country. We both provide a lot of information and access to resources to businesses, as well as advocate on a whole set of policies, everything from access to capital to healthcare to paid leave to other issues around competition. So, yeah, I mean, everything that Sabrina said about the trend being that, that ESI has kind of dropped overall in the last decade or two. And adding to that, the challenges that COVID has put on business owners looking to maintain coverage for themselves and their employees. It is interesting that the market has remained stable in the last 2 months. And in fact, what we're hearing is the so-called Great Resignation has actually created more incentives for small businesses to maintain levels of coverage. Katie's absolutely right that, vast majority of employees really put benefits, particularly healthcare, at the top of the list of what they like about their jobs. And there's been a lot of financial challenges, but business owners have really made an effort to address those. In fact, the number of small firms actually offering coverage, according to the Kaiser, most recent Kaiser study, has actually slightly increased in the last year. We've seen premium increases continue, obviously, but remain relatively steady. I think the latest data is approximately 4% increase in premiums in 2021. And as I said, business owners have really gotten creative to figure out ways to continue to offer quality coverage, even when deductibles are going up and co-pays are going up. They figured out ways to try to maintain the same actual level of benefits to themselves. The other thing is that even though a few businesses have sort of moved toward quote unquote self-funding, that's not really self-funding, or moving to HRAs, the vast majority are opting to remain with the fully insured group market. All of that said, there are definitely storm clouds on the horizons. Our polling shows that 1 in 3 businesses report they've struggled to continue to maintain coverage. 16% have said they've actually had to go make changes to their healthcare coverage. And, I think we're likely to see some increases coming down the pike due to increased hospitalizations around COVID, and also people deferring their health care needs over the last 2 years. And of course, as I mentioned, deductibles and out-of-pocket costs are continuing to go up, even though premium costs have remained steady. Also want to remind everybody that small businesses benefited from PPP loans and other loans and grants during the pandemic, but those have basically ended. And so, that may also be skewing the numbers. We're going to have to wait and see how that plays out. I just want to quickly add, as Sabrina has underlined, the biggest single problem for costs is the underlying costs of healthcare in our system. It's a complex issue, and it impacts both ESI and the individual market. I'm happy to chat about some things we can do about that in the discussion. And finally, I just wanted to add a perspective here. It's absolutely true that ESI is still the gold standard for small businesses. You definitely can get better coverage. It's a huge benefit in recruiting and retaining employees. But half of small firms are offering health benefits, but that leaves half that are not. It also excludes the 24 million self-employed entrepreneurs out there. Obviously, many of those have coverage through partners and other means, but it leaves them out. And if you look at the number of actual total workers covered by ESI, it's only about 40%, and at firms fewer than 25 employees, it's only 35%. So while ESI is essential, and we need to figure out how to shore it up, it's at best only half of the story when it comes to health coverage for small businesses, their employees, and independent entrepreneurs out there. So look forward to diving into some of these issues in a little more detail.
Okay, Tom Liebfried, AFL-CIO, what's on the mind of employees and how things are going there?
Yeah, it's, as I think everyone knows, been a long-standing goal of America's labor movement to ensure that everyone has affordable, comprehensive healthcare coverage. Labor unions do have an important stake in employment-based coverage. Central to what we do is bargaining for higher wages and better benefits for working people. And for a long time, workers have consistently chose the security of comprehensive coverage as what they want when they bargain. And they've been willing to trade off wages to maintain that. Unfortunately, what we've seen quite a bit in the last 10 years is that people have had to forego wage increases in order to maintain the comprehensiveness of their coverage. Particularly upsetting has been when workers have had to accept high deductibles as part of their coverage. And many a contract has been long held in dispute because of changes like that to healthcare coverage. So addressing this affordability crisis is really one of our top issues. And it's not just unionized workers that we are concerned about. 2 weeks ago, the Commonwealth Fund put out a statistic that the median working family will devote 11.6% of their income to premiums and out-of-pocket costs for healthcare coverage. We think this is too high. It's a trend that has been continuing upwards for some time. As others have said, we believe the culprit is high prices. It really is the high prices, stupid. Healthcare coverage, Healthcare Cost Institute, among others, has looked at this, and their estimate was that about 2/3 of premium increases in employer-sponsored insurance could be attributed to the underlying costs. So right now, at this stage, we are very focused on getting the Build Back Better bill passed. One important policy there is inflation caps for prescription drug prices. We believe that's an important political project to show that when all payers and all people have a stake in reducing costs, we can stand down an industry that's charging too much. Anyway, look forward to discussion about that and other ways to address affordability.
Okay, thanks so much to everybody. And we certainly are going to address affordability and costs. But first, I'd like to get us into the impact of the COVID-19 pandemic. Sabrina, perhaps you could address this first. What impact do you anticipate in the future in terms of premiums and utilization that are COVID related, or really what has changed here because of COVID, not only in terms of costs and coverage, but also, do we think that the COVID-19 pandemic has employers looking differently for how to take care of their employees' healthcare needs?
Sure. So I have a couple of thoughts, and I'd love to hear from the other panelists about this. I will say 2020 and 2021 were actually pretty profitable years for insurance companies in general, partly because of COVID-19. A lot of elective procedures were canceled or delayed, as well as preventive care. So we saw insurer profitability go up because utilization went down. The party may be over for those insurance companies. At least, we don't know, of course, how long this Omicron variant wave will last or what that will mean. But I don't anticipate that they're going to be sort of reaping the benefits of that lower utilization. I think it may be that a lot of this delayed care, particularly preventive care, immunizations, and other things that people were afraid to get at the height of the pandemic will start to come home to roost in sort of higher levels of morbidity. But you also asked about how employers have responded to this pandemic. And, in our interviews with employers over the last year or so, what we've seen is just essentially an attitude of like, this is not the time to rock the boat, right? We are not making major changes in our benefit design or approach to how we contract with providers or health plans. We want to keep things as stable as possible for our workers. So that's sort of the general sense that I've been getting in interviews that we've done with employers who purchase health insurance, but I would love to hear from my colleagues here as to what they're hearing as well.
Great. Katie, can I turn to you next to offer your perspective on this? How do you believe COVID-19, how do you believe things have changed, or what are the new factors really that we need to take into consideration because of the pandemic?
Absolutely. I did want to just highlight one fact for the audience, and that is there's been a lot of discussion about deductibles. And I want to be clear that although, yes, individuals have to reach their deductible for the majority of benefits to be paid for by their insurance company, all preventive services are paid for at zero cost sharing on a pre-deductible basis. So there is quite a bit of benefit that is afforded to individuals on a pre-deductible basis. And I think that's really important to emphasize that in order to access care, individuals do not necessarily have to go through their entire deductible to be able to have their annual physical, to be able to get their vaccinations and child well visits, et cetera. So I wanted to put a finer point on that. As far as businesses and employers and what we're seeing in the employer-sponsored system with COVID, my inbox every day comes with articles with headlines such as this: 5 benefits that make your workplace stand out. FinTech leave now includes knee days. These policies will keep your staff from walking out the door. And just 6 days ago, Axios did a report about the forever job crisis and the importance of companies needing to provide a reason for employees to work beyond a paycheck. And so I think we're really actually seeing, instead of a rocking of the boat, I don't know what the correct analogy is other than sort of a fancier boat, perhaps, with greater benefits that are being offered by employers during this particular time. We've seen more and more businesses offering to cover parents of employees in terms of health benefits. I think it's really been a huge surge at this particular time, no pun intended, in terms of the benefit growth and flexibility and innovation that we're seeing in the employer-sponsored system. The other point I'll just make is I think that one thing that Congress did early on during the pandemic really highlights the nation's recognition that the employer-sponsored system is so highly valued, and that is the full subsidization of COBRA from April 1st until the end of September in 2021 in an effort to provide assistance for individuals that had unintentionally and through no fault of their own lost employment or lost hours and therefore lost access to their coverage. And so that was a really significant, I think, message in terms of bipartisan support for the employer-sponsored system and recognition that that is a really critical value.
John and Tom, anything to add to that? And where does this leave us moving forward from here with COVID still in our heads?
I think everything that Sabrina and Katie said is absolutely true. And, we weren't really sure what to expect, but it is true that small employers who have ESI, which is, again, only half of the universe out there, have really made an effort to keep it and strengthen it. And in many ways, what we're seeing around the Great Resignation is that the biggest concern employees have is around benefits and flexibility, even more than wages. So, but as I said, I think the fact that most of the firms that got most of the PPP money were the ones more likely to, the slightly better heeled firms, more likely to have ESI. So some of the pressure was removed there. And as we've heard, it's not, the employers don't think it's time to rock the boat. So all of that is true. And that said, as I said in my remarks, I do think there's some serious storm clouds. And I do think, as you've heard from others, that you're going to see a cost. First of all, we still have a huge problem with costs in general. And I think there was definitely deferred healthcare over the last 2 years that we're going to see rearing its ugly head going forward. And we really don't know. And one of the biggest problems among small businesses is just uncertainty. And now we've got uncertainty around health costs as well. And I think it's nice to quote unquote pat ourselves on the back that the ESI system stayed fairly resilient the last 2 years, but it doesn't mean that we're not going to have some serious problems going forward.
Tom, do you have a crystal ball you could pull out? And what do you, next year at this time, if we had this conversation again, where would we be and where are you hoping that we will be?
uncertainty that John and Sabrina mentioned, I hope that we'll be in good shape. But we are also hearing from our unions that administer healthcare plans that they are concerned about the boomerang effect in utilization. There are new costs that are arising as we confront the virus. The cost of over-the-counter COVID tests. Health plans have been told to cover those in an open-ended way, or pretty open-ended. They're making heroic efforts, I think, to try to meet that need. But the implications of that for plan reserves, future premium increases, all remain to be seen. There have been some positive things, a shift towards telemedicine, and ready approval of mental health visits, specialist visits through telemedicine, which our workers have found very helpful, may prove to be cost efficient. So it's a cloudy crystal ball. We'll really just have to see, I think.
Okay, so let's talk just a little bit more about cost. The Peterson Kaiser Family Foundation Health System Tracker, which gets its data from the Centers for Medicare Service and Medicaid Services at HHS, indicates healthcare spending has increased sixfold over the past 4 decades, and is certainly taking up a much greater share of GDP. So there are significant increases that impact everyone. And so here, Katie, I'm wondering if you can talk a little bit about tools. What tools do large employers have to counteract the causes and cost impacts of these increases? Whether we're talking about labor shortages and supply constraints to just controlling the increasing costs to employers. What are the tools that you see employers using?
Thank you. We've long talked about the value of workplace wellness programs, and I think there is a very long trajectory in terms of when you see the benefits for those programs to play out. But I think you're seeing more and more businesses offering these benefits, and so to the extent that they become a fixture of the employer-sponsored system as individuals potentially move from one job to another. Sort of the benefit of that will carry over. So workplace wellness programs is one thing. I think we're seeing now, particularly during the workforce shortage, an increased focus on other benefits that individuals like, whether that's gym membership, whether that's nutritional guidance, whether that's additional mental health support. I mentioned about that one company that's offering me days. I think those are things that are becoming increasingly valued and sought after, and I think are ways to mitigate more chronic expenses and chronic conditions and greater expenses at a more future time if they are not handled at the onset of a condition. Additionally, we're seeing a lot of direct contracting that is happening with centers of excellence, where outcomes may be far better at a particular provider. And so employers are exclusively contracting with that provider and paying for airfare and other things to make sure that employees can get the services delivered by that provider because the outcomes are so much greater. And the return on investment is so significant. I think one other point I'd just like to make is that I think what we've seen over the past 12 years or so since the enactment of the Affordable Care Act has really been this ongoing question of how can we make sure individuals have access to healthcare services. And I think the Affordable Care Act was largely about making sure that individuals had access to robust healthcare coverage. In terms of reforming the individual and small group market, making sure that, as I mentioned, preventive services were paid at a pre-deductible basis with $0 cost sharing. And so I think the comprehensiveness of benefits has really expanded and become more significant over the past 12 years. I think with that also comes expanded cost. Just like when you go to a shopping store and you put more items in your cart, when you get to the checkout lane, the cost is going to be greater. And so I think now we're seeing the question of access swinging back to costs or prices, as Sabrina and Tom and John have mentioned. And I would just caution us against taking blunt instruments to that current barrier to access. And I'm sure I'm opening up a big can of worms here, but to talk a little bit about access, I wanted to point out kind of how other countries are controlling costs for pharmaceutical items. And so when you look at in the United States, the number of medications that are available for central nervous system conditions, you see 24 new pharmaceuticals were introduced in 2011 to 2018 for that condition. In other countries, it's 10. And so I think that there is another discussion to be had about how artificially holding down costs will also impede access as we're looking at that for the next iteration of reform.
That is a pretty big topic, and the cost of prescription drugs certainly is a major factor. John, I'd like to turn to you and ask you about how small businesses are responding and what changes you see coming in the small business space. And I'll specifically ask you about self-insurance, which you mentioned. So I'd like you to get into that a little bit more and just what the trends are here.
Well, the biggest trend is, as somebody else has said, not making dramatic changes, sticking with basic insurance. We haven't seen, I'll talk a little bit about the self-insurance, but we haven't seen a huge trend in that direction, or even on the HRAs in the last 2 years. It's really holding the line, basically. And so that's the biggest thing that we're seeing. In terms of costs, I mean, look, there are a lot of factors that drive costs, but we're going to have to get real and start to focus on them. I mean, obviously, drug prices are a huge part of that. I know this is controversial, but it seems crazy to us who represent people who go out and compete in the world every day why Medicare can't negotiate prices with drug companies. So that's just like a basic rule of competition. In the States, we're seeing the advent of these prescription drug affordability boards who are stepping in to set some upper limits on drug pricing. And again, I mean, if the system doesn't reform itself through the market, government's going to have to step in and do something because the costs are just out of control. We're seeing things. Obviously, there's no chance of any kind of public option on the national level, although we think that would create some more competition in the market. But you take a state like Colorado, where we were instrumental in getting them to pass the Colorado Health Option, which basically standardizes plans and keeps rates controlled based on increases from prior rates. Again, none of these things are going to solve everything. Katie used the term blunt instrument, but at some point, government has to step in and put some kind of control over it. The last thing I would mention is that there are definitely anti-competitive practices, particularly in the hospital industry with all the consolidations, which then really make it difficult for plans to negotiate, prices with when the hospital controls a huge part of the hospital network of the region. You lose your ability to contract with them. So I know we're working on some initiatives in California to deal with that. So again, none of these things alone is going to solve it, but if the market doesn't figure out how to bring costs a little closer to where they are in the rest of the developed world, government is going to have to step in and do something.
Would the rest of you agree with that at some point and at what point and how does the federal government step in to do something? And is that help with the employer-sponsored insurance? Is it something what is it that, John, you talk about the federal government. What are we talking about here and where are we headed? Katie, you're shaking your head no.
I'll just mention some CBO statistics associated with the Build Back Better plan, which would have allowed individuals in an attempt to address the Medicaid gap problem in states that didn't expand Medicaid eligibility, there is a 2.8 million crowd out figure associated with individuals leaving employer-sponsored coverage and potentially getting fully subsidized coverage on the exchange as a alternative. And I think as we're all sort of singing the praises of the employer-sponsored system, I think it's really important to understand that these public options and these less expensive and most likely less comprehensive benefits are going to really disrupt and rock the boat, to borrow Sabrina's phrase, the employer-sponsored system stability. And so I think it's very short-sighted to think that these government intrusions are going to provide relief in this space. I think it's going to be quite the opposite.
Government action goes on a continuum, right? I mean, we saw a bipartisan bill called the No Surprises Act, which was, of course, about banning balance billing, but I think also has tremendous downstream effects with respect to constraining provider prices, because if you're an out-of-network provider, you have to, essentially, it's sort of probably will, for the most part, will be subject to in-network rates. That was a bipartisan bill. It was government action. I also think there's bipartisan interest in more robust antitrust efforts. We're trying to get these markets a little bit more competitive that have become highly, highly consolidated. So you have these behemoth hospital systems that are essentially demanding whatever price and getting whatever price they demand. So, I think I take Katie's point about a blunt instrument. I don't think there's a political appetite to do, all payer rate setting everywhere, sitting here in 2022. But I mean, to be honest, we're on that road, right? Because the current path we're going down is not sustainable. So unless we can get consensus around some sort of more medium type steps to constrain prices, we're just moving the deck chairs around on Titanic.
Okay, and just a reminder to everybody as we're talking that we're starting to see some questions coming in. You can submit your questions using the live chat on YouTube or Facebook, or on Twitter using #BPCLive. We have a question for John about the receptivity of small business owners to ICHRA. Way to make a defined payment and send people to the individual market. Let's talk about that a bit. And if you could explain what that is for our audience.
Yeah, I mean, it's basically it's saying, instead of being part of a group employer-sponsored plan, we'll give you money and you can use it toward purchasing on the individual market. And as I said, we've seen a little bit of that, but we haven't seen a huge interest in that. And again, it gets back to what a couple of us have said here. Small businesses don't want to rock the boat right now. They have enough issues with workforce, with workforce issues, with the so-called Great Resignation, and the last thing they want to do is start shaking things up in a way that looks as if they're pulling back. So yeah, you can sit down with a pencil and paper or calculator and do the math, and maybe it works that way. And maybe there'll be a greater move toward that at some point. You have the obvious tax, we haven't talked about, and I know we're not really going to get into the detail of this, but the obvious, elephant in the room here is you have this huge tax advantage to actually having employer-based coverage. And so, from every business owner we talk to, that the last thing they want to do is go to their employees and say, hey, we're shaking this up. We're taking something away from you, even if they're really not when you do the math. And right now the move has been to just sit tight, try to shore up as best as possible, try to maybe provide a little bit better benefits to offset some of the higher deductibles and copays, but there's not a radical move toward ICHRA or anything else like that right now.
Anybody else like to weigh in on this?
That's what I mean. We've done some market scans with brokers and employers asking them about these ICHRAs, and I think there are pockets here and there around the country where some employers have taken them up, but I think, as John said, there's just not a huge demand for those at the moment. Of course, should the labor market shift dramatically, or that could change. I do want to flag for employees. While I think these ICHRAs could be attractive for employers because they can sort of cap their contribution and keep that predictable over time. To the extent that costs go up in the individual market, it's the employee that's bearing the risk over the long haul. So there are risks. It's just, again, moving the deck chairs as opposed to tackling the underlying cost drivers.
Tom?
Yeah, I'd like to pick up on Sabrina's last point. Certainly for workers who have organized their voice through unions, the idea that someone would accept a defined contribution from the employer and then, face risk on their own to get coverage or not get coverage. A lot of workers will not find that attractive. And it is our tradition in this country that a good job comes with good insurance. It's perhaps an old social contract, but I think it still exists. And certainly a number of workers, and I grant that it's more likely to be seen with large employers, but that is not a benefit that they will want to leave behind.
Okay, so we've heard workforce come up, and we've got some workforce stuff going on. We've got a workforce shortage in areas of healthcare workers in the way of nurses and also behavioral health specialists. We also have workforce challenges that have surfaced in a wide variety of areas during the pandemic. And, I'd like to ask, does this affect how employers are going to be approaching healthcare? I mean, we've heard employers don't want to rock the boat. But what about the workforce shortage as it is for the shortages in the healthcare industry? How does that change the way that you look at ESI?
Well, I think that, again, just not to repeat myself, but the fact that employers are doing everything they can to hire and retain workers. Just as we've all said, that really, has meant not trying to rock the boat and make changes. So as I think if in an odd way, the Great Resignation has actually strengthened the desire to maintain these and other benefits, and maybe even add benefits, certain flexibility, gym memberships, Katie mentioned. I mean, we're seeing a lot of that. And this is all going to change if the costs, really start to spike for all the reasons we just said. But right now, businesses are hanging in there, and but really the health benefit is a really important thing, and they're trying to maintain what they've got.
So, John, we have a question from an audience member who wants to know about startup businesses. You had mentioned that ESI is a factor for, several of you have mentioned that it's a factor for employees being fearful of changing jobs. And this person would like to know, do you have any thoughts on the impact of ESI on startup businesses and the dynamics of the economy overall? Are you seeing fewer people?
Yeah, I mean, it obviously depends on the industry, but if you're in an industry and you're starting up, if you're starting up a business that is either in an industry that has a lot of ESI, or you're recruiting people who are working in places with ESI, you're pretty much going to have to offer ESI. Now, that's when we think of the term startup, we tend to think of more sort of technologically advanced businesses that are more likely in that space. Obviously, there are a lot of businesses that have started in spaces where there isn't, already ESI, and they may be a lot of the incredible growth we've seen in business formation in the last year, a lot of it's very small enterprises, some of it's solo enterprises, and they're not as impacted. But when you're talking about sort of starting up, if you're in a space, either industry or employee base, where ESI is the standard, you're not going to be very successful recruiting for that, particularly in the current workforce environment, unless you're offering ESI.
So another audience member would like to know whether there is an appetite for employers, both big and small, in a region to band together to purchase or administer employer-sponsored insurance in an attempt to better control costs in that region. This is not the first time we're hearing this kind of idea. Sabrina?
I mean, there have definitely been those kinds of efforts. And one that I think has been touted as a particularly successful effort, for example, is the Peak Health Alliance out in Colorado. A group of employers teamed up with the Affordable Care Act marketplace to negotiate lower rates with hospital providers. And that was a pretty successful effort. I think, these types of consortia can be challenging to put together. And it just requires a lot of coordination and expertise that often a lot of employers don't have. And quite frankly, employers, they're busy running their business. They're not, they want to delegate a lot of this stuff to an insurance company. And of course, those insurance companies are not overly incentivized to sort of turn over the reins that's their bread and butter. So I think, yes, that is something that I think there's a lot of potential there, but it's figuring out how to foster it and sustain it so that you can get meaningful cost reductions over time.
Katie?
I'll just say that the Chamber was a huge proponent of the Association Health Plan regulation that came out under the prior administration. And I think that was a proposal that would have allowed for businesses to band together, both across a region and potentially nationally. We had a lot of state and local chambers that were very enthusiastic because their member companies were clamoring for this type of pooling arrangements. What we were seeing was significant, and comprehensive benefits being offered by these association health plans that were on par with employer-sponsored coverage writ large. And the ability to pool with a greater number of businesses and employees as a result was really very desirable. And so I think it's a great concept. As Sabrina said, I think there are different things that people point to depending on where they are politically in terms of success on this, and certainly appreciate opportunities that are happening and continue to happen without that regulation, but we saw that regulation as a real clear benefit.
Marilyn, I think there's a really important distinction that needs to be drawn here. There's a very big difference between an association health plan that Katie's talking about and something like the Peak Health Alliance, which is an employer purchaser coalition that is going to providers to negotiate lower prices for hospital and other services. An association health plan gets the majority of its cost savings by shifting risk from healthy people to sicker people, bottom line, and from older people to younger people. So yes, you can get lower costs through an AHP, but you are doing so by making health insurance more expensive for small businesses that have older people or sicker people or women of childbearing age. So, I think people need to understand there's a big difference between a purchaser coalition that goes out and tries to get lower prices from providers and one that is just shifting the risk around the risk pool.
And just to clarify, association health plans are still subject to the rating restrictions that govern small businesses. So, and non-discrimination rules under the Affordable Care Act. So to the extent that you're not allowed to discriminate based on sicker people under association health plans,
You are based on age.
But not on health.
And age is a proxy for health.
Okay, so we have 5 minutes left, and we just had a question come in that I think is really a good wrap up for all of you. How different will employer-sponsored insurance look 5 years from now or even 10 years from now? What changes do you see potentially occurring in what the employee gets, what the plan is going to look like, what is going to be offered, just the overall structure, anything like that. And also, we can give each of you a chance to respond. And when you respond, if there's anything else you want to say in closing, you want to leave a point for folks to, your last big takeaway, please include that as well. Katie, can we start with you?
I think the Chamber continues to support employer-sponsored coverage. I think what we're seeing during this pandemic and this crisis and this workforce shortage speaks to the value of this benefit. And as we're seeing, increasing offerings as well as increasing benefits, it I think makes the case.
Okay, John?
Yeah, I think to try to figure out where we're going to be in 5 to 10 years is really difficult. Again, you've got this bifurcated system, and we're fully supportive of ESI, and the idea that somehow you transform out of that overnight is not going to happen. It's not practical. It's not politically feasible, and it is the gold standard now. And we don't want to change that. But I'm going to get back to the point that at the end of the day, costs are the most important issue here. To Sabrina's comment about rearranging the deck chairs, it doesn't. At the end of the day, if the costs in the entire system keep going up in an unsustainable way, that is going to be the biggest issue, and that may drive exactly how our health coverage system is structured. So we need to get a hold of that. And I think that's going to be the biggest driver of where we're at in 5 or 10 years.
And John, let me just follow up on that. And for everybody, whose responsibility is this? Who do we need to look to? What is the employer role? What is the employee responsibility in this? What is the federal government's role in any of this? So if you want to follow up on that, John, and Katie, you're welcome to as well before we move on to Tom and Sabrina.
Well, I think we have a bit of a market failure here. You look around the world and you see costs overall are less. So there is a role for government to come in and sort through all of this. And if that means, coming up with ways to increase competition through direct price negotiation for Medicare, some different forms of public options, or something like the Colorado Health option, where there's a structured way of controlling increases, and obviously the anti-competitive stuff that's going on in the market, the consolidation is driving all of that. So, it's not, we want there to be a market solution, but the market's not solving the problem right now. And so there's government's got to step in, and this is a problem that's this is a huge cost problem in our economy and our society right now. So that's the thought I would leave everybody with. We want to make sure everyone's getting the best coverage. Right now, that's ESI, but the cost issues are going to transform everything going forward.
Katie, did you want to respond to any of that, or shall we move on?
I guess I would take issue with that. I think, to the extent that we're seeing, I think I saw a statistic, something like 90% of businesses with 100 and fewer workers offer healthcare coverage to their employees. I just, to hear you say that that's a market failure, I guess is surprising. And when we hear kind of increasing demand among the American public for employer-sponsored coverage, I don't know that that's necessarily a market failure in terms of the coverage offering. I think that shows some resilience during a time of a health pandemic and a workforce shortage.
Tom?
Yeah, I'll have to weigh in on the side of the government helping the markets here. Hopefully in 5-10 years, we find that prescription drug prices are more under control. We see more private efforts to band together and try to do something about provider prices, perhaps more state efforts. And this might be an area where CMS could provide some templates around global budgets and hospital negotiation. of rates. But hopefully we see innovation in these areas, and that frees up some room to bring down those deductibles.
Okay, Sabrina, give us your final thoughts.
I guess my final thought would be that I think in general, our employer-based system of coverage is at risk. We are on an unsustainable trajectory with respect to costs. And employers can't do it all by themselves. They really can't, and they need help. I would say that whether that's government intervention in terms of breaking up some of the big provider monopolies that exist in a lot of markets, I think that's going to be needed. There may be need for greater rate regulation, but at the end of the day, it boils down to the prices, and we've just got to do something about those.
Okay. Thank you to all of our panelists for being here today. We have a lot more to talk about, so stay tuned. The BPC is going to continue to be working in this space over the next, at least over the next year. So we'd love to hear from you, and we'll continue the conversation. Thank you for being here today.